Hello and welcome to this edition of To Your Health. I'm Szymanski, the Interim President and CEO at Marlborough Hospital. Today we're actually going to speak to you as if we're coming from inside your home, and we're going to talk about the importance of knowing what your medications are, the value that plays to our pre-hospital colleagues, follow that process then through our emergency department, and talk about how we use it then while you might be hospitalized or for when you go home. We call that process medication reconciliation. I know it's a big word. We're going to learn all about each step of that and how important that is to you as our patient and from a safety standpoint to those of us who are taking care of you. In addition to that, the second half of our show, we're going to chat about some helpful things you can do at home in terms of when you should get rid of medications, how you use over-the-counter products, just some practical, helpful tips for you. So I'm very, very pleased to welcome my first two guests. I have Dawn McGinnis. Dawn is the district manager for Patriot Ambulance. Patriot, of course, provides a lot of the 911 response for Marlborough Hospital's service area and is just an incredible patient care partner to the hospital. And Mark Tuttle. Mark is the nursing director for emergency services here and is on the hot seat just about every day in terms of how long patients are waiting. But by talking actually about medications and the medication reconciliation process, all of that actually feeds into taking much better care of our patients and moving our process along a little quicker while we do that. We'd like to tell you that this is 100% electronic. We all have these little chips in our arms, and you just scan them and all of our meds come up on this virtual screen, and we're not quite there yet. So
that would be nice.
We need to talk a little bit about paper at home and then how we convert that once patients arrive. So thank you both for joining me. Dawn, I'd like to start with you. You walk into somebody's home, and usually if you're there, there's a significant problem. So there's a lot of excitement around your arrival in the first place, and now you have to settle everybody down so that you can really get the information that you need to know. When it comes to medication, what are the challenges that you face just trying to determine what medications your patient's taking?
So, once we've arrived at your home, basically we do an initial interview with you or the family members if you're unconscious. And we try to get some information that we need at first off, but then it's always very important for us to try and figure out what kind of medication and past medical history, including allergies that you have. Those all play such a key role in your care. So, we definitely look first to the refrigerator. Every single time there's either a list or a file of life, which is a red magnet that is on the refrigerator that says your medications, your past medical history, and your allergies, and your physician. A lot of times we don't find that. So what we end up doing is looking through cabinets, looking through the kitchen, seeing if you typically keep your medications in your kitchen cabinet, your bathroom cabinet, and it's a search, and it does take some time away from what you really need to get focused on. So, it's a quick search, and sometimes we show up to the emergency room with just a couple of medications, and nobody really knows if there's any more that patient's actually taking or any other, important information. So
you're arriving, and the scene is a little chaotic because everybody's upset. You always have a partner, so the we is the fact that you have somebody with you.
Correct.
So clearly somebody is assessing the patient and starting the care while the other person is trying to collect all the pertinent
Correct.
information. Having spent a number of years working as an ER nurse, ED nurse, the baggies come in, it'll be that little folded up piece of paper in somebody's wallet that has been folded 1,000 times and written in pencil. Those are very difficult to read, and there are patients who are very, very good about keeping things up to date, and others who don't keep a list at all. So I can imagine if you go to a medicine cabinet and it's just full of things, how do you sort out? I mean, you just grab everything and kind of go? Or
you basically kind of do. I mean, you're looking for, if you have a female patient, looking for a female name. But if you're not sure, you're just kind of taking a shopping bag and throwing them in a bag and just sort of handing it off to, the staff in the ER and hoping that they'll be able to decipher, what may be expired, what's there, what's not, you know, what the patient's medical history could be if they're not able to tell us, you know.
Now, let's talk a little bit about why this is so important. You said you want to know allergies. You want to know what medications people are taking currently. Why, for example, would knowing somebody's allergies be important to you?
We also give several medications in the field pre-hospital. So if you have an allergy to a specific medication or medication that they may receive from the ED, it's imperative. You know, any allergy could either potentially be life-threatening. It could, you know, interfere with other medications. So it's definitely something that, you know, we need to know. You know.
Thank you for that. I think that's a really important point. I think, you know, people who have not had to use 911 or have not traveled in an ambulance in a long time may not be aware of the change that has occurred in terms of pre-hospital care. It's actually quite sophisticated at this point. And you guys do start IV fluids, you give IV medications. So let's take a typical patient with chest pain. You arrive, you've collected the medications, you've kind of reviewed them with the patient, and now you're preparing to leave the home. I've got an IV started. What type of medications might you give? Just to give our audience a sense for, you know, how sophisticated the care has become.
It's definitely, you know, per patient and what their vital signs are. But typically with any cardiac event, if there's chest pain, you know, some of the medications that will help alleviate some of the pain and help with your vital signs would be like nitroglycerin. You know, we give aspirin. We definitely start that line, and if, you know, if needed, pain medication. So, you know, knowing the allergies, knowing the medications they're running on, like I said, it's imperative to their care. You know, we don't want to go in blind if we don't have to.
Absolutely, absolutely. And, you know, we should indicate that you do EKGs, and those can be transmitted now back to hospitals so that, you know, everybody can kind of know what's happening to the patient, and it's really pretty impressive, I think, the way the care has changed, even in the last 10 years.
Yeah,
it's pretty impressive.
I think it's important to know that what the paramedics are doing in the field is just about the same thing they're going to get when they arrive in the emergency room. So, you know, the care that is initiated in the field continues when the patient gets to the hospital.
Absolutely. And that's a great point, because there are a lot of people who are afraid to dial 911, and they'll put, you know, people that they love in a car with chest pain and try and drive them here. And you bring all that care to them, so people should never hesitate to call 911 if, you know, if it's chest pain, or, you know, if it feels like an emergency to you, it is an emergency. And call 911.
Correct.
We're going to circle back to the File for Life, because I want to spend a couple minutes on that. So, Mark, all the work has been done by Dawn in the field. Why do I? No, I'm kidding. So all the work has been done by Dawn in the field. The patient arrives here. First of all, what kind of information do you know before the patient arrives?
Well, one of the things we try to do is this is really a continuum of care, kind of one link in the chain of care for the patient. So when EMS arrives at the house, they're collecting valuable information that the physicians and nursing staff in the ER can use. How the patient presented, what did they see when they came upon the patient, what was the environment like for the patient. You know,
so the same kind of handoff we do in the hospital. When we admit a patient, you hand the patient off to your colleagues on the med-surg or the ICU. The same kind of handoff happens between the medics and the ED staff.
Absolutely. You know, the care doesn't stop and start, the care continues. The skills that the paramedics have in the field are the exact same courses. For example, advanced cardiac life support is the same course that the nurses in the emergency room and the physicians in the emergency room partake in.
That's right.
So
you guys are side by side.
Continuum of care.
So now the patient has arrived, and the handoff has occurred, and you're now working on what medications the patient was on at home. That process is called medication reconciliation. Tell me what that is.
So what we try to do is we work with EMS and we work with the family to try and get an accurate list of medications so that we can use that information to help plan the ongoing care of the patient. Medications actually can give us a clue to the history of the patient. If they're taking a particular medication, well, they must have a cardiac history because this is a cardiac medication. So it gives us clues. So if the patient's unresponsive, the family hasn't arrived yet, we're relying heavily on EMS to provide us information about the scene and the patient's initial presentation, and the medications actually give us clues to some of the medical history if we're not able to obtain that.
Certainly you would be able to know if somebody was diabetic and whether they're taking oral medicine or insulin or lots of valuable information. So now they get here and you're going through, and the word reconciliation means you're checking off every single med that you have brought in, whether it's in a baggie or it's on a list or the patient is, you know, reciting the meds to you. So it's important from a medical history standpoint, but why else is it important that you know some of these things?
From a medical history perspective, it's very important, but also it helps to start to set a framework for education. One of the things we want to do in the emergency room, as well as if a patient's admitted to the floor, is provide them discharge education. And one of those educational points is medication. Are they taking the medication appropriately? Should they be taking the medications? Are they taking medications that contradict each other? So by looking at that list, we're able to help provide guidance on the medications the patients are taking.
And then is that information used if the patient's admitted to the hospital? So you write down all these all the medications the patient's taking. Is that used then by the medical staff to order medications for when I'm admitted to the hospital?
It is. That sets the foundation for the medication regime that the patient may have in the hospital. The nursing staff and the ED physician staff try to collect as accurate a list as possible so that if the patient is admitted, the admitting physician has as accurate a list of meds as possible. Some of the things we actually do is we will call local pharmacies and attempt to get a accurate list from local pharmacies.
So we don't trust that we have everything when you arrive.
That's correct. We want to, we want to validate that the med list we have is as accurate as we can make it. Will it be 100%? We hope so. But there may be meds, as Don alluded to earlier, they're not sure if they got all the meds out of the house.
Exactly. So believe it or not, our time goes by way too quickly. I want to circle back to the File for Life. Now you mentioned at the top of the show that there's something that we can put on our refrigerators where we can keep information about our medication. Can we talk a little bit about that?
Yeah, absolutely. It's the File of Life. It's basically a magnetic red card holder, and there's a card inside that flips out, and you can put all your information on it, your name, your date of birth, which is also very important, and of course your address, your primary care physicians in any specialty care. And then of course it goes to your current medications, your doses, how often you take them, and also it has an area for your allergies, and then there is an area as well for you to fill in your past medical history, any cardiac.
That's great. And if my primary care doctor has an electronic medical record, they should be able to print that list out for me as well, and I can put that in the file because the File for Life is a pretty good size magnet. It's easy for you to see when you arrive at the house.
It's nice and red. It's right there on the refrigerator. It's the first place, like I said, that we look. We look right to the refrigerator every time, and there's no getting around that nice red magnet.
That's terrific.
Yeah.
So thank you both very, very much. I think this has been very helpful. We are going to continue with the second half of our show and kind of bring this forward and just talk to one of our pharmacists about what their role is in the process, and then, like I said, give you some helpful tips. So we've heard that we want everybody to have a File for Life on their refrigerator. Do we get one for each individual?
And absolutely, what Patriot Ambulance also is going to start doing is having File of Life magnets available on each of the floors, so that when a patient is discharged, the discharge paperwork can include that File of Life. You can go ahead and fill it right out and take it home and make sure it's right where it needs to be.
I think that'll be really very valuable. And as we become more electronic and we can print out, it'll be so easy for patients to just put it right in in that folder and you put it on your refrigerator. Absolutely. So with that, we're going to take a really quick break, and we'll be right back. Thank you.
WMCT-TV needs your help. Years ago, our archives took a hit, and now we don't have any old programming before 1996. If you have any old Marlborough cable programming, now's the time to bring it to the station at 91 Main Street. You know that old closet where you throw everything? Check in there. Oh! You're bound to find some old tapes in there. Check your junk drawers, attics, maybe even your garage. If you've appeared on TV here or had a child that played high school sports, chances are you have a few tapes hanging around. We'll even give you a DVD for your trouble, and if you want back the old VHS tape, well, we'll even show you what you can do with it. Ha! Whether it's your kids' varsity games from Marlborough High or Assabet, old newscasts, series programs, or even specials, we want them. Just call the station at 508-481-1373 and ask for Dan. Come on, find those tapes now.
Hi and welcome back. I'm Szymanski, the Interim President and CEO of Marlborough Hospital. And today on To Your Health, we're talking about medication reconciliation. So the first half of our show, we focused on what happens at home. The importance of having a file of life and a list of your medications that are handy in case you have to call 911. It's also helpful just when you go for regular doctor's appointments or come into the emergency department for treatment that perhaps doesn't require calling an ambulance. So it's always important to keep that list of medications handy. Then we talked about what happens once you get to the emergency room, how the staff uses that list. And now I'd like to welcome Lisa McCabe. Lisa is a PhD prepared pharmacist that works here at the hospital. Lisa brings one extra thing with her, and that's the fact that she's an RN as well. There are not many pharmacists that bring that additional clinical background, so Lisa is incredibly valuable to Marlborough Hospital and its patients. So Lisa has led a lean project around medication reconciliation. And I want to hear from your standpoint why reconciling medications is so important to everybody.
Well, reconciling your home medications is very important because we really need to know what you were taking at home. Mark and Dawn had talked earlier about medication, having that list of your medications. When you come into the hospital, the condition that you're in is going to determine what medications we want you to be on in the hospital. And based on that, we want to know what you were taking at home and decide, is this something that we want to continue? Do we want to stop this medication, or do we want to change it based on your condition? The other thing is when you come in, we might end up starting new medications. Many of the viewers may have heard of Coumadin, for example. It's a blood thinner. If you come in, say, in atrial fibrillation and you're going to start on this Coumadin, there's many medications that can interact with this. So it's very important for us to know what you were taking at home to determine your therapy while you're in the hospital.
Now, the other thing is, we buy medications from wholesalers. And so we may not always carry the exact same brand. How does that play a role?
So that also affects things. So for example, one of the medications that a lot of people are on is Prilosec. That's for heartburn or indigestion. Yep. And we don't carry the brand name Prilosec here, but we can substitute to a medication that works just as well as the Prilosec does. However, when you get discharged from the hospital, we want to make sure that we're putting you back on what you were taking before, because we don't want you coming to the pharmacy and running into problems with your insurance company and coverage. Yep. So having that initial list of what you were taking at home really helps facilitate your discharge and helps the provider see what we had changed in the hospital and be able to put you back on what you were taking at home.
That's great. So we're really bringing it full circle.
We are, yes.
Now I want to talk a little bit about a safety piece of this. And I know, our audience is going to appreciate this. I think pharmacists and nurses do an incredible job of reading very, very bad handwriting.
Yes.
And as we move into an electronic environment, we won't have to worry about that anymore. Tell me what that feels like to you. I mean, is it really a huge safety thing in terms of the handwriting, and how is moving electronically going to be helpful?
It's very helpful. The handwriting itself, it can cause a lot of mistakes. There's many medications that look alike, sound alike, dosages might be similar, so it's very important to have a very legible information sheet. So right now at Marlborough, we're piloting our electronic medication reconciliation process, and already in the couple weeks that we've been doing it, I see a huge difference. We're able to read these orders, see the dosage, and it's electronic, so if there is ever a question, we can go back to that electronic document to verify information. So it's a big safety piece, because we really want to be able to read that information and make sure we have the accurate information.
Absolutely. And then when patients go home, they go home with a list that they too can read.
Yes.
And I think it's going to be incredibly important. So Lisa, since we have you, I want to just switch topics a little bit here and talk about medication safety at home. I know when I go to my parents' home, once they buy something, I feel like they have it for a lifetime. I'll say to my parents, "When's the last time you used it?" "Oh, I don't even remember." But they're afraid to throw them out. So I wanted to talk to you a little bit about patients, this prescription or the bottle of pills or medication, there's always an expiration date, correct?
Yes, there is. There should be.
So I should look at that, and if it's even, is it 30 days over, 1 day over? I mean, when do I get rid of it?
So typically you'll see the expiration date on the bottle. Sometimes it will give you the actual month, date, and year. Other times it will just give you a month and the year, and you should consider that medication good till the last day of the month that it expires. And I would highly recommend that you don't keep meds beyond their expiration date or use meds just for the safety risk. You want to make sure that it's potent, that it's still a good medication. So you really shouldn't keep meds beyond their expiration date.
The other thing, Lisa, that I want to touch on is we know that a lot of our patients struggle sometimes being able to pay for their medications. And we hear stories about people cutting their pills in half, so they're only taking a half a dose to save money. And I want to talk. Can you talk to us a little bit about whether, of course, that's not good to do, but why wouldn't I do that?
So you want to take your medication exactly as your physician's prescribing it to you. And if you're not taking it like that way, you should let your provider know about that. For example, blood pressure medications, if you're only taking half of the dose and your physician is looking at your vital signs, looking at your blood pressure and heart rate, they might make changes based on what they think you're taking as opposed to what you're actually taking. Mm-hmm. So you really want to make sure that you're taking it as prescribed. And if you are struggling with paying for medications, definitely discuss this with your pharmacist or your physician, because there might be a generic alternative available that you could use. Many pharmacies do have $4 prescription programs, so there could be a different medication that we could switch you to that would work just as well for your condition, but you wouldn't have to worry about that cost
about
factor.
The big copays. That's so helpful. Now, Lisa, a lot of us take over-the-counter things, whether it's vitamins or herbal supplements. There's an awful lot lately about, check with your doctor to see what interacts, and why is that so important? And are there things that really interact with stuff that we take every day?
There are. So we want to make sure that on our medication list at home that we include anything that we take over the counter or herbal supplements. And a lot of people don't think of those as medications, but they are medications, and they can interact with a lot of other medications that you're getting. I had talked earlier about Coumadin, which is our real big one that can interact with a lot of meds. Mm-hmm. And certain herbal supplements like ginkgo might interact with that, or aspirin if you're taking it at home, or Aleve for pain, or Advil. Those things can interact with Coumadin and actually increase your risk of bleeding. So it's really important that you let your doctor or pharmacist know all of the medications that you're taking, so that way we can try to avoid untoward events from that.
So taking ibuprofen, Advil, Aleve, they all have a blood thinning effect as well?
They
Is
do.
that why
They
we
do.
get concerned about
yes,
them?
so it can cause an additive effect with the Coumadin. So that can increase the blood thinning effect and increase your risk of bleeding.
There has been a lot of information around Tylenol lately, and Tylenol is, I think it's an over-the-counter medication that we take very lightly, but it has some pretty dangerous side effects, and I think we're learning more and more about that all the time. We don't have a tendency to think about Tylenol, though, as really over-the-counter like we would a vitamin. And so how do you advise people around the use of Tylenol or Advil or some of these other over-the-counter products?
So if you're taking these medications on an as-needed basis, definitely let your doctor and pharmacist know. Again, even these things that you're just taking once in a while as needed are important to keep on that medication list. You want to follow the directions on the bottle. You don't want to exceed the dose. For example, with Tylenol, they are changing their strength that's available. It used to be available as a 500 milligram tablet. Now they're changing it down to the 325 milligrams because there can be effects on the liver if you exceed the maximum dose of Tylenol. So you want to be cautious, and you don't want to exceed a certain amount per day. Typically in the past it was 4 grams of Tylenol, and that's might be lowered soon, but you want to stay within that range. And a lot of like cough and cold products, those contain Tylenol in it, so you want to look at what the ingredients are in the things that you're taking, because you might be doubling up on certain things without even realizing it.
So that's so true. When you take like a flu medication, you're right, it has acetaminophen or Tylenol or Advil or one of those in it to kind of deal with the aches and pains, because it's supposed to not only do cough and your runny nose, but also take care of the fact that you don't feel great. I want to talk a little bit about our patients that go home, that are discharged home. And because I know that you're working really hard on the clinical pharmacy program, and we're really looking very carefully at teaching patients about their medication. Many people go home and they look at that piece of paper and they say, I don't have a clue. Is this for my sugar? Is this for my blood pressure? Is this for my... Can we talk a little bit about how important that educational piece is?
It's very important. You should definitely know the medications that you're taking and why you're taking them.
Is it okay for me to ask if somebody doesn't offer it?
Definitely. If you have any questions about your medications, ask. You can talk to your nurse on discharge. They should be providing you with education on all of your medications. If you have questions beyond that, you can ask to speak to a pharmacist. There's always somebody available who can come and talk to you before discharge on your medications.
So I should know, regardless of how long that name is, and some of them, you know, I think I'm always amazed you guys can pronounce those. You must stay awake at night, working on how to say all of those letters. That, you know, I should know what the shorter name is, and what, but most importantly, this is my blood pressure pill, this is my heart pill, this is, and so can I ask somebody to put that, write that down for me?
You definitely can. So if you're discharged from Marlborough Hospital, you'll be provided with a very nice typewritten list of the medications that you're taking. Now with our new medication reconciliation process, it will also tell you what meds to stop taking that you were at home, which is a really helpful piece of this. And definitely ask your nurse to discuss these medications with you. You can ask what they're for. They can write that in on the sheet, and then you can add this to the file of life when you get home.
That is great. And if you go to a retail pharmacy to have your prescriptions filled, the pharmacist always says, do you have any questions? I don't know that I've ever heard anybody say, yes, I do. But those, you know, they are as well educated as you are, and they can certainly discuss all of those pills with you. Now, you know, sometimes we get our prescription filled and there are 8 little stickers on, you know, it's amazing sometimes how many of those little stickers you guys can put on those bottles. But it'll say interacts with foods and different things like that. Those are things that we should also discuss with either our primary care doctor or the pharmacist before we leave.
Yes, because the retail pharmacist is a great resource that might be underused. But if there's any questions about how to take a medication or the information on the medication bottle, you should definitely ask questions about those medications.
Because, you know, do I take this before I eat? Or do I take it after meals? Can I take it with milk? Do you know, empty stomach, all of those kind of things. And it's, you know, I think it's really important for people to know that those pharmacists know all those answers, and it is okay to ask them those questions.
It is.
So Lisa, thank you so much. I think this is going to be very, very helpful for our audience. So we've spent the last half hour talking about medication safety. Even though we may have kind of couched that in medication reconciliation, it's really all about keeping you, our patients, as safe as we possibly can. So the things to take away, I think, from today are that you need to always keep a list of your medications, whether it's in that file for life, that's where we'd like you to keep it rather than in your wallet, but in your file for life on your refrigerator. You can keep a duplicate copy somewhere else so that you have it available when you go to your doctor's office. And to stop and ask questions about your medications. If it looks different, if the label is different than you've ever seen before, if you have questions about what kind of food you can eat or when you take the medication or what this particular medication does for you. Always think about what you're taking every day and anything that you're buying over the counter, and there's an expert in every pharmacy that can help you answer those questions. So please don't hesitate to ask the nurses or the pharmacists here, because our pharmacists are certainly interacting with our patients here, or your retail pharmacist. So thank you very much for joining us.